Hi, this is Lisa Gable. I'm the CEO of FAIR, and we have a number of people on the online, and I know a number of people are also going to be joining us. But I'd like to get us started because we have a lot of information to convey to you today. It's really a pleasure to be pulling together our first meeting of the National Board of Ambassadors. This is a new non-voting board that FAIR set up. We're very excited about it, and the reason that we are excited is that we see the opportunity to utilize the people who are part of this effort as being individuals who, through their networks and their own personal relationships and the vast networks that you have and the positions you hold in your community, to elevate the voice of the patient at a very important and critical period of time. We're at a major inflection point. There are a lot of companies in the consumer good space stepping forward, as well as pharma, in research. We have OIT conversations happening. And so this is really a critical time for us to define the message, elevate the message, and be able to tap into the relationships that you have in order to bring the science to scale. And when we talk about bringing the science to scale, it's how do we utilize our education to bring it to moms and dads through their pediatricians, through registered dietitians in their schools, through the school lunch ladies, through other individuals who can assist us in ensuring a safe and inclusive environment for our children. But secondarily is how do we bring that science to scale through therapies? How do we bring it to scale by ensuring that there are more product offerings that provide more choices for moms and dads? Today, we're going to give you a lot of information. We're going through three aspects of our 5-year plan. One is awareness, 2 is research, and 3 is education. And you'll have 3 different speakers who are part of our senior team here at FAIR. In the future, we will be coming back to you with a 5-year advocacy portion of our plan. And so we look forward to having you back for that piece. But what I'd love to do today is first thank some of the folks who are on the phone. I know that we have Mike Lade, who's a longtime activist and board member for FAIR, who's vice chair of our National Board of Ambassadors, and we appreciate all the work that Mike has done. And today I have the privilege of introducing you to Kim Yates-Grasso, who is our chairman of the Board of Ambassadors. As you may know, we honored Kim at the FAIR Gala that was in the December timeframe, and really utilizing Kim's ability to bring together people from across the United States to focus on the implementation of this plan, on the patient voice, on standards of care, and other critical issues. So at this moment, I'd like to introduce Kim, give her a moment to introduce herself, and then we can go through the various speakers. Thank you, Kim.
She on the attendee list.
Kim, do we have you on the phone? We had you a few minutes ago, and I think we may have you on mute.
Can we unmute everybody? Okay.
There we go. Kim, you are unmuted.
Try that.
Jackie, if you would unmute me. This is Susan. She's dialed in as me.
Great. Susan, you're unmuted, so go ahead.
Kim?
Okay, well, why don't we do this? We're going to come back to Kim, and I'm going to take you immediately to our first person who is speaking and ensuring that we have an opportunity to keep moving this forward, and then we'll come back to Kim and have her do the closing remarks and introduce herself. So speaking first, we're going to have Vanita Boswell. Dr. Vanita Boswell is Campaign and Creative Director and is the person who's the brains behind the Contains Courage campaign. So Vanita, would you like to get going?
Absolutely. Thank you so much, Lisa. And it's such a pleasure to be on this call this afternoon. And just thank you, everyone, for your hearts and your service and your generosity. And we're excited to take you through this campaign. I joined FAIR in July of last year. My background is in 20 years of fundraising and integrated brand marketing. I worked for the UN, the Acumen Fund, and I was the head of fundraising for the Girl Scout movement, and then launched my own firm in 2014. I met Lisa at the Girl Scouts. She got in touch with me last year and said, I have a really exciting opportunity, and here we are. So we're going to take it away now. So on this slide, you'll see just the excitement that all of us have that's shown here with our leading lady on this slide. As you know, FAIR is the largest private funder of food allergy research in the world. And what we're really doing is elevating, as Lisa said, the patient voice and really bringing hope to the 32 million Americans currently living with food allergies across America. Next slide. So we want to be able to show not just, we know that our families are more than numbers, and we want to be able to show data both quantitatively and qualitatively. So we think this infographic is a good demonstration of the quantitative numbers and what they actually mean. So there you see the 32 million Americans who have food allergies, and what it breaks down to, meaning in adults and then in children. And this number, actually, we just updated this number just a couple of months ago based off a study, and you can see the study at the bottom there called Prevalence and Severity of Food Allergies Among U.S. Adults out of the JAMA Network. And previously the number was 15 million Americans. So this is a full-blown epidemic, and the word epidemic is something that we want to be able to use that, and we want to use that powerfully to be able to raise awareness with our neighbors who may not be connected to the disease. Next slide. Furthermore, we want to be able to talk about what this means, not only just for kids, but what this means for adults. So our very own Dr. Ruchi, she actually was the lead researcher on the study, on the prevalence and severity of food allergy study. So this is a snapshot of elements from the study of statistics talking about how the disease itself is affecting adults, and that this truly is a public health crisis. Next slide. So based on the data that we know, Lisa came in as CEO, as you all know, in the summer of last year, and we really had to look at the organization and what we had to do to be able to support what was happening with food allergy families, what we needed to do as a brand, and the pillars of the infrastructure we had to create to be able to meet our strategic objectives. And so we're going to take you through what some of those organizational positionings are. Next slide. The first is that we want to ensure the qualitative piece of this. So how do we tell the story about the statistics and the numbers? It's all about storytelling through impact. So here are some of the impact numbers that we've created here. And another piece of this was ensuring that we were looking at how we may have indirectly also affected communities across America. And a perfect example of that is where it says 1 million plus auto-injectors stocked in more than 54% of the nation's schools. As an organization, we didn't go and actually stock those auto-injectors, but due to all the incredible advocacy work that FAIR did over the summer and into the fall, that was the result of that. Next slide. The other bit that that is just truly incredible is a timeline kind of showing you the impact that FAIR has made in research and innovation and how we have been accelerating that. And Nuri's going to take you through this in more detail from where we were and where we're going. But this is just to show you how we're not just advocating and raising funds, we're also taking those funds and putting them back into research and therapies for families. So through all of these things, it was about looking where we were, understanding the impact we've made, and then it was very clear that there was an emergence of priority initiatives that came to the forefront. And Nuri's going to take you through that in more detail. But the umbrella kind of this is how we are messaging not only to people who already know about food allergies and are in the FAIR family, but how are we giving them a storytelling platform for them to easily be able to talk about the disease to their neighbors who may not understand truly where the disease is at this stage. Next slide. So how we did that was create a campaign, which we have called the Contains Courage campaign. And and you can move it to the next slide as well. How we came up with the name of Contains Courage is we took a look at the brand name of FAIR. FAIR obviously is an acronym for Food Allergy Research and Education. The acronym also means food. So we talked to over 200 families living with food allergies and talked to them about what it was like, what their needs are, what day-to-day living is like. And what we heard over and over again is that families were tired of being labeled by their food allergy, and they wanted to be labeled by the attributes that they could hold in society and their dreams. And then we were able to talk to families not living with food allergies, and they said that they were reading food labels as well, but they were reading it for healthy lifestyles. And so the idea of labeling kept coming up. And so we thought we could put a provocative kind of twist on labeling and be able to create a campaign that had a storytelling ability to it, where individuals could talk about the ingredients that made them up to be in the resilience and the grit to make them be who they are. And then that would be the story of how they contain courage. So with the campaign, we launched a video in December of last year. And to launch the campaign, we filmed that in Houston. And Mike Lade was a huge advocate for us there and helped us gather kids so we could really elevate the kid voice. And we also, on our website, we launched an email address called containscourage@foodallergy.org. We launched this in December, and right now we have almost 300 photographs and stories of courage that have already been submitted by individuals across America who were not originally associated with FAIR. So we're really excited about this. This campaign is a 5-year fundraising and awareness campaign. In year 1, we are launching in the 10 cities that are listed in teal there, in the teal section there in the second bullet. And then in year 2, we will scale up to another 10 cities so that by the time we finish the campaign in 5 years, we will have reached every state. And so to the right there, you can see an example of a photograph of someone, the ingredients that they hold, and how they contain courage. Originally, the campaign was launched focused particularly on kids. And due to the overwhelming success of the campaign, which also on its launch reached over 4 million media outlets, we now are going to be launching just in the coming weeks about how we are including in phase 2 of the campaign adults as well. So we're really excited about that. I'm now going to take you through the activations quickly of the campaign. So we wanted to be able to harness communities across America. And in order to do that, this campaign had to be able to leverage national media as well as mobilize people locally and at the grassroots level. And so we came up with a series of activities that would occur, at least one of these activities in each one of the cities. So I'm going to take you through, the activities are listed to the right, but I'm going to take you through each one of the activities in a little more detail. Next slide. The first is the FAIR Health State Data. It's important to note that FAIR, the spelling of FAIR, there is actually who did the organization that did the, it's a coincidence, but the organization that did the study, that's their name. But this is really important. This health state data actually shows the prevalence of food allergies in particular states. And so we have uploaded this on our website, and we have worked with Clyde Group, our PR firm, to engage with families in these local cities and cities across America to be able to tell their story to the local media. And we're able to leverage this quantifiable data to be able to talk about the disease. Next slide. The second activity is what we're calling the Contains Courage sporting events. And so we really wanted to leverage our connections with the NBA and other sporting organizations to be able to provide really fun experiences for our families. And so there's a list of games. Some of them have already started and occurred, and it's just been really great hearing the feedback from FAIR friends and from families across the country. And so we're really looking forward to the games that are even happening this weekend. So at each one of these games, the teams have organized with us and facilitated how we raise awareness differently. So at some of them, there's a speaking opportunity for FAIR. At others, our PSA is being shown during halftime or during kickoff. At some of the games, there's actually potential like allergen-free seating there, and there's at least one concession stand at the games that provides allergen-friendly also products as well. Next slide. The third activity is what we're doing for Food Allergy Awareness Week. So Food Allergy Awareness Week is May 12th through May 18th. This year, the theme, we're obviously going to leverage the campaign, the Contains Courage campaign. And so there are two particular events that we're going to be hosting. The first is the Corporate Think Tank, which is May 14th. Lisa talked about in her opening how we are engaging with consumer-facing food brands. And so what we want to do with this corporate think tank is we really want to elevate FAIR as being the convener of the conversation. So how do we bring brands together, major brands, Nestle, Coca-Cola, Pepsi, who are those brands that we can bring them in and kind of educate them on what's happening with the disease, but also give them a safe place where they can talk about their consumers and how they may need to enter into the space and how and where they are in their journey of entering into the space. So we're really excited about that. We're going to be doing a whole bunch of other things during this week. We're going to be doing a whole social campaign where we're asking people to wear teal, take selfies, post it with the hashtag Contains Courage. We are also going to be working on lighting up the Empire State Building teal. So there's just several, and looking at who are the social influencers and who are the celebrities that we're going to be partnering with that week. Next slide. Restaurant Week, this is something exciting too. Every major city has it. So during the summer and fall, we're going to be picking those cities that are going to be having Restaurant Week and working with major restaurant chains to be able to raise awareness around this campaign, and also to be able to create experiences for families and to introduce some dishes on the menu that are allergen friendly as well. Next slide. The next is a Contains Courage talk at colleges. So think of what we know and what has been a success, which is a TED Talk model of experts and researchers and college students. So what we really want to do is engage people who are advocates or investors or researchers in food allergy and talk to them about what is it, the ingredients that made them into who they are, to then want to spend their time and their lives focused on this particular disease. So was it failure, the failure that could be in science before you then have the success, or is it the grit or the resilience? And we're really excited about this. This also gives us ability to have corporates come in and sponsor these talks. So each one of these talks can be powered by a sponsor, and we will be posting these on YouTube, pushing them on social media, and putting them on our website. Next slide. This next campaign activity, super excited about. It's what we're calling the Contains Courage Global Citizenship Summit. And so it will happen in the fall of this year, and it will be built off the great success of the FairCon Teen Summit. And what we really wanted to do was create a space where what we heard from families is they want their kids to feel empowered and liberated. And what we know works for adults and for kids, people of all ages, is there's no better way to feel empowered than to feel like you're a global citizen, so that your community is bigger than just the streets that you live on, and how in turn can you learn more about what's affecting you, and then take that knowledge and then become a change agent for somebody else. And so this, again, we're going to be convening conversation for families to come to DC, to experience. Brands will show up to have a trade show, to interact with families. And then the rest of the weekend, we'll be working with the education team, who will come up with the kind of programmatic pathway that these kids and families will go through to learn more about food allergies, and we can all work together to figure out ways to advance our work. This is also built off of what we just talked about, the idea of global citizenship. And so this is the Community Action Day. And so what we really want to do in certain cities of the 10 cities for the campaign is we want to look at how we leverage our Incredible Collaborators program at FAIR and work with other nonprofits around a Community Action Day. This is also can be fundable by a corporate sponsor to come in and to say, hey, we also partner with Girls on the Run. And so we're like, great, can Girls on the Run, FAIR, and you as the corporate come together to really affect change in your backyard and communities and families who are going through some sort of crisis, and it doesn't have to just be food allergies. So we're really excited about this event. It's the ability to raise local media and national media as well. And now I'm going to pass it over to Nuri.
Thanks, Vanita. Hi, everyone. This is Nuri Hong. First off, I'd like to say again, thank you to Vanita. That's always exciting to see and be walked through. So, as a food allergy dad, I'm really excited to see all those events. I'll go into the research and innovation strategy here at FAIR. Just by way of quick background, again, my name is Nuri Hong. I'm Chief of Research Strategy and Innovation at FAIR. My background is actually from the healthcare and biotech and pharma industry. I worked at a strategy consulting firm for many years, from 2010 to 2017. I was a partner leading the life sciences work out here on the West Coast. And about 2 years ago, I decided that I was going to leave that career and pursue startup opportunities in food allergy. So I'm actually, have been working on potential very early stage therapeutic startups in food allergy. But had an opportunity to wear a much broader hat in terms of having a broader impact, that is. When I joined FAIR last year and helping to take FAIR's existing baseline and think about where the organization, the foundation could make an impact in the future. So with that, and the background that Vanita just gave in terms of the Contains Courage campaign and the significant amount of fundraising that we are aspiring to raise here, what are we doing with that money and how are we thinking about actually making a difference for food allergy patients? So if you go to the next slide, we went through a very comprehensive and 360 view perspective of how do we think about the needs in food allergy going forward and how could FAIR make an impact. And you saw a version of the slide earlier that we really concluded around a core set of priority goals that you'll see here in the various color bold font. So there's a very comprehensive campaign and strategy that we are pursuing. It starts with the overarching campaign that Vanita just walked through, and really everything that is related to the advocacy, education, and amplifying the voice of the patient. And as you can see, that large green bar really provides an overlay and informs everything else that we do, which is much more around driving towards new solutions that are going to help food allergy individuals. And while this is a research and innovation strategy, it is not just R&D per se. So in many of these boxes, there are activities or solutions that we're thinking of that are not just novel drugs or diagnostics. We are thinking about raising the baseline for care and the way that we that food allergy individuals live their daily lives and trying to make an impact near term, midterm, and long term. With regards to some of the core if you could go back, if you look on the left two sides of that bottom row, establishing a baseline and understanding of disease and elevating the quality and access to care, those are two areas where we think about just really elevating and raising baseline of our understanding for this disease, as well as the care that patients can get today. And we have many initiatives under those buckets that we are going to pursue, and they really bookend opposite ends of the spectrum. On one hand, you have very novel research into new discoveries and solutions, but on the other hand, you also have new solutions that are about making it better for individuals today. On the right-hand side, you have initiatives that are more focused on really being targeted and thinking about what kind of solutions we could advance and trying to reduce the barriers or helping to accelerate those innovations through funding mechanisms of various types. And we'll talk about some of those different mechanisms that we have in mind, but we're thinking much more broadly than just grant funding and traditional research funding, and trying to think about ways to really kickstart and push some of these solutions forward. If you go to the next slide. Of course, one of the questions is, well, what are the capabilities that FAIR has to be able to accomplish such a broad and ambitious research strategy? And, well, to begin, there's quite a lot that we have to build on, which is really exciting. And you can see here on the left-hand side a couple of, critical examples of the types of things that we've been able to establish or have accomplished in the past. For instance, we currently have a food allergy registry, which is the largest in the world, with over 6,500 patients enrolled and growing. And we have an increasing number of partners who are looking to work with us on that registry and expand it. We're also, still going to fund research through various mechanisms and trying to leverage a clinical network that we've established in terms of the FAIR clinical network sites. And there are 33 of them today, and we hope to really elevate what they're able to do in terms of conducting novel research and trials in food allergy, and have a whole number of partners that are looking to work with us to try to understand how they can access that capability so they can do trials, using world-class resources in food allergy. We're also expanding the kind of mechanisms. So I mentioned just a moment ago, we have a lot of different ideas of how to, advance solutions, whether that's partnering or informing others in different ways, but also getting involved and helping to fuel the research or investment into new technologies or solutions of different kinds. And one of the mechanisms that, we're modeling off of other foundations like the Type 1 Diabetes Foundation's JDRF, is to establish a food allergy dedicated philanthropic fund through FAIR, which would be a separate capability not operated by this group of individuals per se, but would be FAIR funded and would be focused on food allergy to enable us to have a mechanism to fund really early stage research and get that into the hands or advance it to later stages so other investors and partners can bring those forward. Those are capabilities that we have, and we certainly want to continue to access. We're also expanding, as you can see on the right side here, an influential network of world-class clinicians and researchers that FAIR has had long-standing, access to and continue to grow a network of, leading research and clinicians to work with. But also, a powerful board of directors, board of governors, national ambassadors that are willing to step up and start participating and helping us, achieve the goals and the kind of strategic initiatives that we have planned. The way that we view ourselves, though, is that we want to be the convening force of the community. We want to be in the middle to help connect the dots where we can help advance solutions for food allergy individuals. And so we know that part of this will require, for FAIR to partner externally as well. So while we have a number of capabilities that we want to leverage and a network that we want to tap into to help us achieve these ambitious goals, we're also very much, as Vanita alluded to and mentioned throughout her presentation, looking for external partnerships so we can take our knowledge of what food allergy individuals want and need and make sure that the folks out there that are actually capable of providing those solutions, whether they're researchers, academic institutions, or industry partners, so they know where to focus their efforts and how to think about developing, solutions that will matter and will make an impact. So we're really excited because as we've continued to, really flesh this strategy out and get more specific into the types of initiatives we want to launch and the kind of capabilities that we want to partner with, the reception from all ends has been incredibly positive and exciting. And I think that consistently what those external partners, how they view FAIR is providing that patient voice and that ability to really provide the insights of how to, to make an impact. And if you go to the next slide, the way that we're thinking about this, and this is really a lot of detailed examples of the specific initiatives, if you were to go back to each of the priority areas that we laid out previously, as we continue to lay out each of the initiatives that we want to focus on, we really map that out across the entire patient journey and are thinking about how to impact that journey at every step of the way and across the different types of individuals living with food allergy. So we have a lot of individuals who have food allergy. They come in different shapes and sizes and experiences. And those experiences change over time depending on where you fall. And what's most exciting, though, is as you dig into each one of those points along the journey, there's a significant opportunity for someone to be able to make an impact. There are things that we can do today and in the near future that will actually result in positive outcomes and in impactful solutions. And the reason why we are, stepping in to fill that role is because there's still a need for us to be able to do so. So we believe that by being that convening force, we can bring the community together to be able to really come up with very smart strategies of how to achieve each of these bullet points and opportunities, and are looking to do that in a collaborative and partner way. So we're really excited. It's incredibly, there is a lot here that we want to tackle. And of course, we're going to phase this over time and be pragmatic around how do we build our capabilities and partner in a way that we can execute and be successful. But we're really excited about the early momentum that we've been getting, and really the opportunity to take food allergy and transform it to the next level. So I'm going to pass it from here because the next section will focus on education, and I'm going to turn it over to Mary, who will walk us through that.
Thank you so much, Nuri, and thank you all for being here today. My name is Mary Rollins, and I'm heading up the areas of education, advocacy, and marketing communications for FAIR. I'm a newbie here. I've just joined recently after spending about 26 plus years at Discovery Communication, which is the largest provider of digital content, global content, in schools and across the world. I headed up education and partnerships for most of my tenure there, and now I'm here and really enjoying an opportunity to take the wonderful and ambitious research agenda that Nuri has pointed out, and of course the exciting campaign, and figure out ways that we can meaningfully and comprehensively wrap around support through education, advocacy, and marketing, and elevating and amplifying that very important patient voice. Everything we do is always grounded by what we know, and so we're lucky to have a lot of folks in the room and around the world that give us information and inform us every day. But what we do know is that we have about 32 million Americans that have food allergies, and we spoke earlier in the call about the research that has pointed that out. That means that in a student's classroom, there's generally roughly two kids, that are affected directly by food allergies. We know that hospitalizations for kids who are suffering food allergy incidents has tripled over the last several years. We know things about the psychosocial effects of food allergies. We know that food allergy sufferers are more likely to be bullied. And most importantly, and this informs much of what we do in our college work, we know how important it is during those teenage and young adult years to be very mindful of the food allergy situation. And we know, unfortunately, that's the highest risk state. So all of these kinds of points of data lead us to what we're really focusing on in the area of education. And we really want to focus on, we call them the 3 C's for shorthand: content that's meaningful and scientifically based and very relevant; community, which is how we engage others, including those on this phone call today, and our many, many feet on the street that are working on our behalf day in and day out. And then college, we separate that out a bit because it's such an important area of interest and concern for us at FAIR and for everyone. We want to develop world-class content and training materials so that we can educate and activate not only patients and caregivers, but also those who work with them, and importantly, those who just need to flat out understand the importance of this public health concern. We want to expand our footprint in communities nationwide, so we are aggressively looking for like-minded organizations that want to come on board with us. We extend our hand and say, join us as a collaborator to help us better understand the needs of our patients, and to help also leverage the content and assets that we have across these organizations. In terms of college, we believe that colleges and universities who are doing a great job managing those who step foot on their hallowed soil that have food allergies, we want to make sure that they are given a competitive advantage, that kids who have food allergies and families who've been affected and those who know people who are affected really see this as a great benefit of attending that higher education institution. So we work very closely to support that college community. And then just making sure that all of the knowledge and insights we have, the subject matter expertise we have, is shared liberally throughout not only our organization, but the organizations that we work with on a day-to-day basis. So our mission and focus area is pretty simple. We want to elevate food allergies not only as a public health issue, which I think is very important, but also we want to elevate the patient voice, and we want to make sure to do that with everything we do. And the areas we focus on across multiple modalities, across multiple stakeholder groups include awareness, inclusion, prevention, and of course, emergency protocols. And so just briefly looking at our functional areas, these really support very directly what our goals and objectives are. We have an area that focuses very deeply on education content and trainings, making sure we're getting out there with world-class content wherever we can to provide meaningful educational activities for patients and caregivers, for those who suffer, and then again, as we spoke earlier, for those who do not suffer directly but need to understand the importance of the issue. We have a team that works very directly with volunteers, community engagement. So these are folks that are working with our like-minded organization partners, and also working with just that person sitting across somewhere in a computer across the country that's interested in doing something, that's just a flat-out interested advocate or volunteer. And our team makes sure we know who they are, we support them as best we can, we give them the tools they need to succeed in their local communities. We do conferences, and Vanita mentioned the Global Citizenship Summit coming up this fall, which we're really excited about. But we're looking for opportunities to be at places where people are, where our message can be heard. These are places where we have conferences that are gathering hundreds or thousands of people, and we go and we do not only trainings, but we'll also be there to make sure we're meeting and greeting with folks and offering an opportunity for them to work with us here at FAIR. And then last, we've spoken a couple times about our college program. We have a couple of initiatives that are really exciting. One is an opportunity for colleges to come onto our college search site and input data that tells us and then can tell a student what are they doing to serve the needs of a food allergic student who may or may not be choosing their university. So we ask them things like, how do you work in a food service setting, and how do you work with non-food service areas like housing and team sports and those kinds of things. So we're rapidly growing this initiative, and we think it'll be a really exciting, continue to be very exciting for our student base. So a lot of exciting things going on in education. I think Lisa mentioned we're in the process of putting the final, crossing the T's and I's, dotting our I's on a major 5-year advocacy initiative, and we'll be rolling that out shortly and looking forward to sharing those details with you at later times. But at this point, I think I'm going to turn it over to Kimberly Yates, and I'm hoping the phone gods are with us here, and Kim's going to wrap up this phone call. So thank you very much. Kim?
Hi, everyone. Can you hear me?
Yes.
Okay, perfect, perfect. Thanks so much, Mary, and thank you, Lisa and Vanita and Nuri and Mary for your incredible presentations. I'm unbelievably excited to be a part of this mission and this new vision from FAIR. I've been around FAIR for quite a long time, and I'm honored and excited that I have been asked to chair this National Ambassadors Committee. And just to give you guys a little bit of background about myself, some of you might know our story from the New York Times article that came out quite a while ago, but it was a story that kind of talked about our past. My mission started about 16 years ago when my daughter Tessa was born with about 20 different food allergies, at least 10 of which were life-threatening. And along my path, I was on the Fix It mission. I like many on this call, we're told to avoid and we're handed an EpiPen, but after 4 nearly fatal reactions, that answer wasn't good enough for me. So I was very fortunate to happen along to hear Kari Nadeau speak at Stanford about 9 years ago, and asked her what she could do to help kids like Tessa with multiple food allergies. And she looked at me and she said, I don't know, but I promise I'll figure it out. And I asked her what she needed from me, and she said resources. So Kari and I partnered about 9 years ago and joined forces. And she went to work on the science side, and I went to work on the community side. And it was, my mission to help her build a center at Stanford. And just as the speakers have spoken before me today, as it was a grassroots effort. It was picking up the phone and calling one allergic parent to the next allergic parent. And we were able to raise the funds for the first multi-clinical study that FAI at the time was very instrumental in making happen. So I'm super grateful for that. And Tessa was able to be treated for multiple allergies at the same time. And she graduated about 6 years ago, and I'm happy to say that she can actually free eat at this time. My mission has continued. It's very important to me to be able to give this same story to others. And the New York Times was an incredible way for me to be able to meet people from around the country. It put me in a position of being able to be an ambassador and a community builder, and maybe an evangelist, for lack of a better word, for oral immunotherapy, but have been able to build community around the country. And we have seen how successful it can be at Stanford. And we know that if we can join forces and pull people together from around the country, we can have an incredibly massive impact. So like I said, I'm so grateful that I was asked to chair this committee. I'm incredibly excited to speak to those of you that are on the call that are interested in joining, those that have already agreed to join, so that we can talk about the various ways that we can build community in our various areas. And I've whether it's salons in homes to speaking in colleges to, so many different ideas that we've been doing over the last 9 years at Stanford, and I'm so excited to be able to do it on a national level for FAIR. So I'm not able to put my contact information up here, but I know you have Michael and Susan's contact. I am so happy to speak with anybody individually that might be interested in getting involved. And if there's a question, but I'm really excited to meet those of you that have already decided to join our team. But I know that bringing everybody together, we can have a much more a massive impact than if we were to try and do these. It doesn't work to work in a vacuum. And FAIR, I'm so incredibly excited about this new vision. And it's going to take, a village, more than a village, an army of families with food allergies, because we're the most driven. And I think with that, I'll just end it. But I'm incredibly encouraged and incredibly excited by this new mission and this new vision. And I really hope those of you that are on the call will join forces with us and be a part of our team.
Great. Well, Kim, thank you so much, and thank you for stepping up to do this, and thank you, Susan and Michael, who pulled all of this together and have been in communication with you all. As Kim said, Susan and Michael's contact information is on the screen, and for those of you who are already members of Ambassadors, let us know if you have questions or thoughts. We want everybody's comments and inputs, and those of you who have not joined yet, we would love to have you. As I said at the beginning of this, everything we are doing is about scale. And as we move forward, our ability to mitigate risk for food allergic families can only be achieved as the number exponentially increases to 32 million people, is to ensure that we have the scale in order to meet those needs. And you on the telephone bring scale to us from the standpoint of the voices that you have, the respect that you have, the networks that you have, the fact that you are key influencers both nationally and within your communities. So if you are able to help us elevate the voice of the patient as we're trying to see that new therapies get through the FDA, as we're trying to ensure that medical professionals are talking to people about the results of the LEAP study, as we are trying to onboard companies across a wide variety of spectrum who can bring choices for moms, dads, and patients in the category, we need your help. As I said, we will come back to you with a 5-year advocacy plan. That is the last piece of this stool that is being developed as we speak. We look forward to engaging you in that process. The last thing I'd like to point out is that we did tape this webinar, and so we will be distributing the webinar to individuals who are not able to join us today. If you need a link so that you can share it with people that you know may have an interest, please let Susan and Michael know. With that, I will give you back about 12 minutes of your time today. And once again, thank all of the presenters, thank Kim, thank Mike Lade, and others who have been key leaders in the FAIR community for many, many years. We are very excited to be at this point and look forward to working with you. So thank you.